affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Good afternoon, California. Welcome to another Ask the Expert show. For the last 16 years, we've been bringing you the top experts in the field of legal, health, financial, and home improvement. A little story behind our next show. I got to tell you, we, for the last 3 years, have been inundated by our listeners and viewers asking us to do a Medicare show. The only problem is we had no openings between that and our other shows. And this year, because California is our largest market, I said, I've got to get somebody good for California. I'm going to make room for them. And that day, we found Peter Joseph with a Joseph Insurance Broker. And it's like, I couldn't believe we were so lucky to find him. Good afternoon.
Hey, Steve, how are you?
Hi, Peter.
It's a pleasure being here. I appreciate this time for sure.
Oh, I got to tell you, you saved my life because, I told you I'm still on Medicare, but I was one of those people who did not understand, had no knowledge at all. And by the time I found out, it was very costly to me. And I don't want people to have to go through what I went through with Medicare. And I'm going to tell you something. I'm going to add one more thing to it. This is why I'm so glad we've got you, is my first agent was horrible. He it was like everything he should have told me, he didn't. And the next year, I did find a good agent here in Florida. And what a difference. So it's so important that you find a good agent like Peter. Peter, tell us about Joseph Insurance Broker.
Yeah, I've been doing this for 10 years. We do have an agency out here in Southern California. I actually have agents all over the United States, and we do specialize in Medicare and health insurance. As Steve was saying, you definitely need a trusted broker. It's a confusing process. Plans and regulations change every single year. And so you definitely want someone who's an advocate for you, who's by your side, doesn't leave you abandoned to figure things out on your own. And so we definitely do a great job of checking in with our clients at least 3 to 4 times a year. We don't just sign them up. It's not one transactional and then goodbye. We want to make sure our clients are happy and understand their plans to the full effect.
Well, I got to tell you, you really do your work. We just did a Medicare show in New Jersey. And one of the things I shared with them is about 10 months into my first year, received a call from Humana, and they said, why are you not using your over-the-counter allowance? And I went, what over-the-counter? And I found out, Peter, that I had $400
Oh my
that I
goodness.
could go to CVS or Walgreens, and I got it. And this is something that my agent should have told me about.
I agree 100%. I mean, that's our job, and we need to put little reminders, especially towards the end of the year. We call our clients and make sure that they use up the rest of their over the counter if they haven't used it, because that money gets lost. You lose it. I mean, if you don't use it, you lose it. So you
Yes.
definitely want to access those funds because they're free for you. So why not?
Exactly. I know this is a dumb question, but I got to tell you, I know there's a lot of people out there like me who don't understand about Medicare, and we're right in the middle of the open enrollment right now. What is Medicare?
So Medicare is there's a couple of things. Medicare is the federal guidelines for health insurance for those over 65, as well as those who are fully disabled. And then the Medicaid or Medi-Cal out here in California is the state-sponsored health insurance plan. So, a lot of our clients get those mixed up, but Medicare is something that we do get access for free if we work 10 years here in the United States full time. Did I lose Steve here? Uh-oh. I think Steve froze. Steve, are you still with me?
I'm there. I think we got
Oh,
frozen there.
yeah, you got frozen there for a sec. I was just I was making sure we're still talking to each other.
So now there's a difference between Medicare and Medicaid, and a lot of people don't even know what that is.
Yeah, so Medicare is federal and Medicaid is state, and then out here in California, of course, they have to have a different name for it. It's called Medi-Cal instead of Medicaid, but that is the state-sponsored health insurance, and it's for those that are lower income or impoverished, and then those for Medicare, that's for everyone turning 65. If you've worked 10 years here in the United States, then you get Part A for free, and then Part B is what we all pay.
We act like we hear parts A, B, C, and D, but Peter, a lot of people don't know what those are.
I know,
Explain
I
what
know. So
each part is. I mean,
so
you get this every day. I know.
Oh, I do, I do. I mean, and they're thinking of adding more letters, believe it or not. And I said, no,
Oh,
no, no, please don't.
yeah,
We've got enough letters
exactly.
to confuse our seniors with. So, yeah, Part A is our something you get free when you turn 65, and that's for your hospitalization, skilled nursing facilities, hospice, those kind of things. And then Part B is for doctor visits, lab work, preventative care, those kind of x-rays, all those kind of things fall under Part B. Now, we all pay into Medicare when we work, but we still have to pay something. Some of our clients think Medicare is free, and it's not, unfortunately. Um,
Right.
there is a base pay that we have to pay. So it's right now this year it was 185 per month, and that covers Part B. And then Part D is in dog. That's for your prescription coverage. So that covers anything that's either over the counter or at your pharmacy, like CVS, Walgreens, Costco. And then the last thing, I don't want to confuse you guys too much, but Part C, as in cat, that encompasses A, B, and D. So that's called a Medicare Advantage plan, and it's all inclusive. It includes all those parts, and that's like usually an HMO or a PPO network.
Peter, I got to tell you, I've had friends of mine say, "Oh, the government doesn't know how to do anything right. They screwed up Medicare." I got to tell you, I love Medicare. I think it's the greatest thing. And it's funny, I've even had some brokers call me up who wanted to have their own show, and they told me they can't wait till they turn 65. And that's coming from a broker.
Wow, wow, that's great. Yeah, I mean, honestly, it's gonna cut your costs down significantly when you go on to Medicare. I'm dealing right now because we do health insurance for those under 65 as well. As we all know, after the government shutdown, we're not sure if those subsidies are gonna get extended. And so a lot of people under 65 are dealing with premiums that are going through the roof for next year. And, I always tell them if they're 63, 62, just hang in there a couple more years and your
Right.
costs will definitely decrease.
What's going to happen with health insurance, Peter?
That's a great question, Steve. We're all kind of waiting to
I don't
see what
think the
happens.
Congress even knows.
No, they don't, unfortunately. It's a mess right now, and I think things do need to be fixed. Obviously, the subsidies do help a lot of individuals out there make health insurance affordable. And if those don't get extended, the system needs to be fixed somehow. So if they don't extend those subsidies, they need to revamp what health insurance looks like for those under 65. That's for sure.
We just got our first text from Sacramento. Um, I keep hearing about this open window. Can you explain what that means?
Yeah, so a lot of people think, it refers to everyone that's on Medicare. It is an open enrollment if you're on a Medicare Advantage plan or just original Medicare. October 15th through December 7th gives you that opportunity to review your plan and then change it for the following year. Now, if you are just turning 65, then this enrollment period does not apply to you. You have your own enrollment period. So when you turn 65, you have 3 months prior to your 65th birthday to enroll, your birthday month, and then 3 months after. That's your window to enroll into Medicare. So that's the big difference.
And Peter, who qualifies for Medicare?
So really, anyone who is in the United States for 5 years as a citizen or works 10 years full time and pays into Medicare, you qualify for Medicare. Now, if you don't qualify for Medicare, you are able to pay a fee monthly for A and B. It is pretty pricey, so hopefully you do qualify for Medicare, and we can get you into a plan. And then you have to be, 65 years or older. You also have to be, you could be on full disability for 2 full years and you automatically get onto Medicare. So that's also another opportunity for you to get onto Medicare.
I'm on the Medicare Advantage plan, but I also hear there's an original Medicare. What's the difference?
So here's the difference. Original Medicare only covers 80% of your cost. So that's why folks always go onto either a Medicare Advantage plan to help cover that gap, or the other journey would be a Medicare supplement or called Medigap plan. And that covers the other 20% Medicare doesn't cover. Those tend to be pricey. They do allow you to see whatever doctor you want. There's no network to those plans. But the thing is, you're going to be paying for what you get. So with those plans, you're paying an extra, usually about $150 to $200 premium per month, as opposed to Medicare Advantage. You're not paying anything usually premium wise for those plans. So that's the big difference.
Uh, we just got a question. Do you do prearrangement and long-term care?
Wow, that's a great question. Yes, we do a lot under our belt, and that is one of the things we also specialize in. We do long term care. We also do life insurance in connection with long term
Mm.
care as a writer. So those are opportunities that we do, and we also do annuities. So a lot of folks that we run into have 401ks that they don't know what to do with. A lot of times, to protect them from taxes, you roll it over into annuity and you have a lifetime income. So that's kind of a safety net for our seniors.
Well, I got to tell you, after the Medicare is all over, you're with us for a while. I promise you, we'll do a show on annuities and life insurance because it is really important.
It is. And you definitely, so, a lot of folks think that Medicare covers our long term care costs, and unfortunately, it doesn't. It does cover about 120 days of skilled nursing facilities. If you're on full Medicaid, then you do have access to assisted living senior facilities. But if you're just on Medicare, unfortunately, if you didn't have something in play in the beginning, you don't have a safety net. And so Medicare does not cover any long term care costs. And so our seniors get shocked by that. They think it does. And so we definitely want to make sure they're well taken care of.
And God, Peter, long-term care is so expensive. People need to start thinking about that now, not waiting till it's too late.
I agree. Obviously, the younger you are, the cheaper the policy is going to be. So, even if you get in, so long term care, we can actually have that policy out to you up to the age of 75, believe it or not. But
Mm,
I will give the caveat that the older you are, the more expensive it gets. And so
exactly.
that target age is probably around 50, 55 that you want to shoot for to get onto a policy.
What about, do you have to sign up for Medicare if you're still working?
That's a great question. And I actually ran into a client who's kind of in a stickler situation. So most folks don't know this. So if you are still working and you're at a an employer that has more than 20 full-time employees, then you can stay on the health insurance plan with your employer. Now, if it's under 20, I know these are weird rules, but if it's under 20 full-time employees, you do have to go onto Medicare. And the way to sign up is there is a form that we have available that we send out to our clients that you drop off at the Social Security office. Now, if you are still working and then you retire, there is a form that you would fill out so you don't get penalized getting onto Medicare after you turn 65, if that makes sense. So, and we've got all those forms available for you. Here's the stickler with the client that we had. They ended up leaving their employer. They were retired, and then they went on to Cobra insurance. Well,
Mm.
unfortunately, Medicare sees Cobra as not credible coverage. And so a lot of folks end up staying on Cobra for several months and then they go into Medicare. And lo and behold, surprise, surprise, they get hit with a penalty
Uh,
because they thought Cobra was credible coverage. And unfortunately, it's not. And so that's why you need to get with a broker before you turn 65 so we can walk you through all those steps.
And people, they listen, if you've waited this long, I'm telling you, you need to call Peter today because there's a lot of things that Peter has to do. I mean, I was shocked when I finally got a good agent because you got to want to make sure that you've got the right doctors in place, you've got, hospitals. There's a lot of legwork that Peter has to do to find you the correct plan, isn't that right?
That is right. I mean, we have to check all medical networks, make sure your specialists are in network so you don't lose those
Yes.
specialists. We need to know a list of all your prescriptions to make sure they're covered and affordable for you. And one thing I want our audience to know, Steve, is that Medicare brokers aren't allowed to charge our clients. So if that ever happens, please get out of that situation.
Oh,
It is
yeah.
illegal for that to happen. We get paid directly by the insurance companies, and we get paid the same no matter which company we put you with. So we have no bias. We're here to help you make the best decisions for your health benefits.
Here's a great question just came in from Chris in La Jolla. Said, "Thank God for your show." He said, "I just found it today. Uh, Please ask your expert about, does Medicare cover dental, vision, and hearing? Because at our age, those are the three most important things." Thanks, Chris.
Yeah, no, that's a great question. So just like Steve said, he's on a Medicare Advantage plan. That's probably a great option to go to because that's going to include most likely a dental, vision, and hearing option for you. If you go the route of a Medicare supplement or Medigap, that's what's called an a la carte system. So that means you have to get a separate dental, vision, hearing plan if you go that route. If you go with the Medicare Advantage, it's already included in that plan, most likely. That's what the broker is here for. We look through all the carriers, and each carrier has different plans. Some have a dental benefit of 2,000 per year. Some have what's called an allowance, where you've got money you can take to the dental office and use that for any dental procedures. But most Medicare Advantage plans will include those.
I got to tell you that, I was talking about it's so important you have a good agent. I didn't even realize I had eye care. I mean, I had to hear it from Humana telling me that I have eye care because when I went in for glasses, they said, "I think your insurance is going to cover this." And I went, "No, they don't cover this." And eye care is not cheap. Eyeglasses
No,
are
it's
not
not.
cheap.
It's not. And
So
go ahead.
it's so important. I just want people to understand, we have Peter on here for a reason, and it's so important that you've got a good agent representing you.
Yeah, I agree. And I think, the other thing we want to make sure you guys are aware of is that, anything that falls under cataracts or glaucoma, that falls under medical. So you are covered as well for that. But Steve is right. There's Medicare Advantage plans that give you money for doing your preventative care. So if you go in for a colonoscopy, there are some carriers that will pay you gift card money to get that procedure done. And that's where us as agents come in and let you know about those things. So you don't want to pass those up.
Yeah, and I got to tell you, when it comes to pharmacy, Peter, I was talking about this on my last show. I'm on the skinny injection, and I'm really proud to say I am. But it's like $1,000 a month, and my Medicare was only $30 out of pocket the first 6 months, and nothing the next 6 months. I
Wow.
mean,
Wow.
I love Medicare.
Yeah, I mean, and a lot of the prescription drugs that majority of folks are taking, they're starting to come onto the formulary list, which means they're going to be covered by Medicare. Prices are starting to come down on drug prices, so that's a good thing for Medicare as well.
When is that going to happen, Peter?
So that's supposed to happen next year is the first phase, and then the year after that. So there are a list of prescriptions. I know Ozempic is one that's going to be covered.
Yes.
The other one is Eliquis, which is a heart medication. That's a big one that a lot of our clients take, and that's going to come down significantly next year.
I wonder, have you heard anything on insulin?
So the good thing about insulin, there is a cap of $35 per month on majority of plans, and I think that's even going to come down in a couple more years. So, but yeah, that's the cap. $35 is the most they can charge you.
We just got right. We only have a few minutes left.
Okay.
We just got a text from enjoying your show. I want to make sure that Peter handles health insurance also, and you say you do handle health
We
insurance.
do. Yeah, we're contracted with Cover California out here, and we do the what's called ACA or Obamacare currently all over the United States. So if you need help with that, we definitely address those needs as well.
Peter, tell everybody, your show went by so fast.
I
Tell
know.
everybody how they can reach you.
So you can call us directly. Our business line is 909-217-2630. You can appointment with us at our website, josephinsurancebroker.com. That's JOSEPH, insurancebroker.com.
Well, and we will be repeating the show next week. You can also go to iHeart or YouTube to watch or listen to the show again. Peter will be with us next month. Hey, Peter, have a wonderful Thanksgiving. I
Thank
know
you
this
so
is
much,
your
Steve.
busy time of the year, and hey, we're going to be doing a lot of different shows coming up after this is all over with.
I'm excited, and happy Thanksgiving to you as well.
Thanks, Peter. You're the best. Give Peter a call. I'm telling you, don't wait. Um, I'm just so glad that we have him. Hey, that's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.